Perfect. Look at God. We're rolling. Jumping, baby. Okay. So this PowerPoint is also on Canvas that you can see. It's all the way at the bottom, dealing with neck and trunk. I wanted to do a couple of shorts so that you could see kind of the information.
Okay, so this tutorial is on the back muscles. If you want to learn a bit more in detail about the back muscles, look at my individual tutorials on the extrinsic muscles of the back and the intermediate and deep muscles of the back. I talk about innovation, insertion, and all that kind of stuff in a bit more detail than I'm going to do here. So I'm just going to work from superficial to deep and point out some of the major muscles that you should know about. So this muscle here is the trapezius.
So this video is really good. I'm not going to go through the whole thing because it's just too much to do. I'll show you this one. I thought this one was hilarious, and it's actually really good. So if you have a chance, click on the last one. I'll upload this PowerPoint. I don't know if I put the videos in the one you have, but I'll upload this one with the videos. I thought this was great.
Back muscles are superficial, intermediate, and deep. The deep muscles are intrinsic and good posture they keep. Superficial and intermediate back muscles work is not lax. They're extrinsic and stabilize the vertebrae and thorax. The superficial ones originate from your vertebrae and attach to shoulder bones, humerus, clavicle, scapulae. They include the trapezius and the latissimus dorsi, as well as the rhomboids and the levator scapulae. The trapezius runs from your neck down along your back. Its three portions form a trapezoid, which we will unpack. The scapula is lifted and rotated by upper fibers, retracted by middle fibers, and lowered by lower fibers. Moving beyond the latissimus dorsi, origins are numerous. It converges on a tendon that attaches to the humerus. From four cervical vertebrae, the levator scapulae originates, attaching to the medial border of the scapula, which it elevates. The rhomboids retract and rotate the scapulae on request. The minors above the major, remember for your test. The intermediate group has serratus posterior, inferior, as well as the serratus posterior, superior. Serratus posterior, inferior moves part of the rib cage. It depresses ribs 9 to 12 when it is engaged. Elevating ribs 2 to 5 is the superior muscle action, and these muscles might have slight respiratory function. Deep muscles together run from the sacrum to the skull space, help with vertebral column movement and keep posture in place. They're covered by fascia, which for organization is key. Into superficial, intermediate, and deep layers 3. Two superficial, deep muscles, splenius, capitis, and cervicis. Assist hand and neck movement and form spinal transversalis. The spleen.
Okay, so this is good. I thought that was funny. No, you do not have to learn that song. If you do, that's on you. I will give you no extra points for learning that song. But it is a funny song. It is a fun song. So I will put that up there. You can watch it. It's a good song to learn. All right. So let's dive to the back. Grab your clinical book. Grab your anatomy book. We're going to chapter 9. We're going to learn how to palpate muscles of the spine. See? It's addictive. You're going to start singing that now. Before you know it, you're going to end up singing. Like, man, I can't believe I'm singing this today. Okay, so we're going to jump to page 148. The reason I wanted you to bring this one instead of bringing the lab book is I wanted you to not only see the pictures, see the origin and insertions, but think your way through it. So let me have a volunteer. We're going to work our way through sternocleidomastoid. The easiest one is platysma. Is the eek muscle. So when you do eek, it's like a sheet muscle that you may or may not see depending on your patient. Different people will have it, some people won't. It just depends on the patient. You'll see it really well on people who do. You may see platysma. It doesn't function to do much of anything, so we don't really cover it. So the three major ones that we do cover, sternocleidomastoid is a big one. We'll cover that one, and then the scalenes are a big one that we'll cover, and we'll separate that from the levator scalp. So we'll separate scalenes from levator scalp, and then we'll get prevertebral muscles in suboccipitals. So give me a volunteer. Let's do that. We'll do some lying, and then I'll sit you up and show you the ones in sitting. Come on down, sir. I don't know why they volunteered you first, but we'll make it work. All right, on your back for me. So usually, if I'm doing this with a patient, certainly I would have a pillow for them so that the head could rest. The first one, sternocleidomastoid, is one that we can find easily, superficially. Palpate mastoid process, which is going to be here. It's going to run from here across the neck, and it's going to attach to the sternum, and it's going to attach to the clavicle. So clavicle here, sternum here, and it's just a huge, thick muscle. On most people, if you palpate the lateral side of the neck, you can grab the muscle. So that's it right there. Tight. Yes, sir. And so if you have them perform, so remember, it does side bending to the same side, rotation to the opposite side. So when he does that, you can see this huge muscle belly right here. So let's do it this way so that we can see it coming from on that side. So a huge muscle belly right there. So actually turn it, yeah, there we go. So a huge chunk of muscle right there. So it's very palpable on most people. It usually will get tight on people and it becomes spastic. And the reason why is because it takes over moving the head and neck. It becomes a dominant muscle because the prevertebral muscles aren't strong enough. So if I have weak prevertebral muscles, I'm going to have overly aggressive SCMs, and that's going to give me a lot of neck pain. So we'll show you how to relax SCM a lot when we get to E-stim. I have some really cool E-stim tricks to show you that's really great for that. The prevertebral muscles, you don't have to go through the names right now, but they're going to run right here in the front of the neck. So they run like this in the front of the neck. They are going to be responsible for helping you to do chin tucks, the ability to nod your head down. And so what you want to do is gently lay your hands across the front of the neck. Don't push down because you're going to choke someone. So don't push down. You just want to lay your hands there. Communicate with your patients. I'm not trying to choke you out. Just lay your hands on the front of the neck. And you want to have them, so if I'm laying my fingers on, I have my fingers like this, my index on their chin. So my index is here, my fingers are here, and I'm going to help them learn how to nod. And if you do that, you can feel prevertebrals right here on the front of the neck. The goal is to teach them how to feel prevertebral and no SCM. So you want to tell them, if I have this as if he's my patient, I'm going to have him, so lay this hand flat across here like this, and now bring the other hand, come across here like that, and now just relaxing. Don't grip it. Now, I want you to try to tuck the chin down. You should feel right here at the front and nothing on the side. Agreed? So that's a normal contraction. Front, no side. If they're feeling side, then they are getting too much recruitment of SCM. And you don't want that. So you want to teach them how to do that. So if they're getting that, one of the things you can do is roll up a towel and put it underneath their neck. So somebody throw me a towel. Give me a couple of this if you don't mind. So, if he was having trouble doing chin tucks and SCM was coming on, what I would do is just do towel rolls underneath his head. So I just roll a towel, put it underneath his head and neck, and that puts his head in a little bit of extension. Extension turns off SCM. So because bilaterally when SCM contracts, it flexes the neck. So if I want to turn it off, I need to put the head and neck in some extension. And this puts your head in extension. See that? So that turns off SCM. So I put him in this position and I teach him how to chin tuck from here. And I have him go do this at home 1,000 times until you can activate prevertebral muscles without activating SCM. Okay, makes sense? So that's the motion there. Okay, so that's SCM prevertebrals, front of the neck, not the side. Okay, suboccipitals are the next one. They're going to be the muscles that, let your head relax, they're going to run from the occiput. If you grab the end of the occiput, so right where the head meets the neck, so that's where the occiput meets C1. The suboccipital muscles lay right between the occiput and C1. So usually we can't feel them, but we'll do a technique called suboccipital release. So gather around so you can see what we're doing. It's similar to what I just showed you guys earlier with the fist traction. So there, your hand was under the suboccipit, it was under the occiput when you were doing this. So this feels good and it will help to relax it. Another thing we can do is get our fingers in this position so it looks like a claw. So both hands are clawed and we put them right underneath the occiput. So right underneath where the occiput is, let the head rest down on your fingers and you're just pushing in and up. So you're pulling back and then pushing in and up. So I'm trying to pull his occiput toward me. So my fingers are doing this, like I'm saying, come here, and then they're also pushing up. So it looks like, all right, so it looks like this motion, so that's toward me, and then up. And so that stretches out the occiput. So what I'm doing is taking his occiput, and essentially what I'm doing is, if his head is here, I'm pulling his head forward and up like this. So it's like I'm making his head nod forward by stretching. So grabbing the occiput and pulling it forward and up to stretch out those muscles underneath the occiput. So suboccipital release, like that. So I want my index over by the mastoid processes, my other fingers just spread out underneath his head, and again I'm saying come here with my fingers and then pushing up a little bit. Yeah, reach behind the head and grab it here. And so that usually feels really good to people who have suboccipital tightness. They have, posterior head and neck pain that they just can't get rid of. It's a great stretch for that. And so I would do the fist traction thing first to calm down the headache and the pain. Then after that calms down, I would do the suboccipital release to help them to feel even better. Then you reassess. How does that feel? Oh man, I feel like a million bucks. Whatever you did worked. Yeah. Easy stuff. Okay, so find SCM, palpate prevertebrals. Use the towel underneath the head if you have to, so that you can feel prevertebrals here, but no SCM at the same time. And then suboccipital release. Underneath the occiput, remember the fingers should say come here, and then push up. So here and then up. Up there, up. All right, find those three. Let's have some fun. Hey, I seen you do that. serving the Lord. Oh, let me see. Thank you, Holy Spirit. Oh yeah. Oh man. Side being rotated. Oh no, she just go. So she's doing that one. You want to contract side being. Side being the same, rotate it out. So don't just push it up, like pull back towards you. And you kind of push them in a little bit. But let your hands relax. You're working hard. Not a track, it's just pushing. You're grabbing and saying, come here first with your fingers, so you're doing this, and then pushing both. He needs it. Your hand wants to move, yeah. He needs it. It's called sub-occipital release. Yeah, so it's different than fist traction. Yes, sir. Pre-vertebral without SEM involved. So you want to get a scoop right there. There you go. Now relax it. So now you want to feel. Put your fingers flat. Real gentle. And now, put your chin up. You want to feel here in the middle with nothing on the side. And that lets you know you're contracting pre-vertebral, but you're not contracting SEM. The SEM is bad. You don't want it contracted. So bring your fingers in. You just kind of hold it. See the fingers under, like that. You're pulling, you're saying, come here with your Yeah, no, so your thumb rests on the side of the face. And just pull it like that. Real gentle. It's a very gentle technique. Not meant to hurt our arm. Okay. Yes. Flat knee. Good man. So when he lets go, it tightens back down. Relax, face. You doing something right? You're not dying. Come in first. Keep these thumbs more forward. So here. You don't want to work that hard trying to hold her in. Just right where you are, you're in the right spot. Down here. Push. All right. So, all right, 4:30. Holiday, we'll pick it up on Monday. All right. How's your neck feel? Let's take it. We'll look at it and make sure you're not dying. Can't cause death. Have a hard time explaining that to y'all parents. You can't.